The way you rest your head on your pillow every night. Could it be the silent cause that is erasing your most cherished memories? It sounds like a horror movie, an exaggeration, but I assure you it's the raw and alarming reality that the most advanced science is revealing. Imagine for a moment that your bed, that place you associate with rest and security, has become a battlefield for your brain. And the most disturbing thing of all is that this silent war is mainly fought in the minds of those who, like you, have crossed the 60-year mark, a stage of life where lucidity is not a luxury, but the fundamental pillar of our dignity and independence.
I am Dr. Cezar Villarreal, a specialist in brain health and conscious aging. For over 2 decades, I have dedicated my life to a single mission: to help men and women armor their minds against the passage of time, to maintain a memory sharp as steel, and to cultivate a well-being that allows them to be the protagonists of their own story until their last day. And today, I am going to share with you knowledge that can literally change the destiny of your brain.
In this video, you will not only understand which sleeping position, according to science, is directly linked to the acceleration of dementia, you will understand the exact mechanism by which sleep becomes your best doctor or your worst enemy, and most crucially, you will take away a step-by-step action plan to start protecting your mind starting tonight. But before we dive into this revelation, I want you to pause. Think about how you've woken up this last week with a feeling of clarity, of energy, of being in control, or rather with a mental fog, with that frustrating feeling that words escape you or names vanish. I want you to be brutally honest with yourself. Write in the comments a single word that describes your morning awakening: clarity or fog. Your answer is the first step to becoming aware. And while you do that, take the opportunity to subscribe to the channel and activate notifications, because the information you are about to receive is too important to miss. Now let's continue. Perhaps you think that sleeping your prescribed 8 hours is a sufficient shield. You are mistaken. The way you lie down, the posture your body adopts during the night, could be sabotaging the most vital process that occurs while you sleep: your brain's self-cleaning. Imagine your brain as a bustling metropolis. During the day, there is incessant traffic of thoughts, emotions, and decisions. This activity generates metabolic waste, toxic residues, among which an infamous protein called beta-amyloid stands out. If this protein is not eliminated correctly, it clumps together, forming sticky plaques that suffocate your neurons and lay the groundwork for the development of Alzheimer's and other dementias. Night is when this metropolis's cleaning crew goes into action. But if you sleep in the wrong position, it's as if you put up barricades on all the streets. The garbage trucks cannot pass, and the toxic waste accumulates. Night after night, year after year. Today we are going to dismantle those barricades. We are going to talk about scientific studies published in the world's most prestigious journals. We are going to hear real stories from people like you, and I am going to give you simple techniques that can transform your bed into a sanctuary of brain regeneration. Are you ready to discover the truth? Dementia is a silent epidemic advancing by leaps and bounds. According to the World Health Organization, more than 55 million people are living with it right now. But the projection is what should chill us to the bone. This figure is expected to triple by the year 2050. Think about what that means. That in the not-too-distant future, 1 in 3 families could have a loved one whose mind is slowly fading away. This is not an external problem, it's a direct threat to our future and that of our children. But here's the key that many ignore, the piece of the puzzle that traditional medicine often overlooks: the intimate, almost symbiotic connection between the quality of our sleep and the position in which we sleep. For centuries, sleep was seen as a simple state of inactivity, a shutdown of the system. Today, thanks to neuroscience, we know it's quite the opposite. Sleeping is an active, dynamic, and absolutely vital process. It is during deep sleep that our brain performs its most critical maintenance. It consolidates memories, repairs neural connections, and, as I already mentioned, carries out a deep detoxification. What makes this conversation so urgent is that most adults over 60 don't sleep as they should. And what's even worse, an alarmingly high percentage sleep in the wrong position, unknowingly jeopardizing their brain health every night. Dementia is not a lightning bolt from a clear sky. It's a storm that forms slowly, silently, drop by drop. And many of those drops fall during the night, while we believe we are simply resting. That's why talking about this now, taking action now, can be the difference between an old age full of lucidity, conversations, shared memories, and an old age marked by dependence, confusion, and the pain of not recognizing those you love most. You know someone who has started to forget things? Important dates, grandchildren's names, where they put their keys. Perhaps you've noticed it in yourself. Small lapses, oversights that you attribute to age, to stress. Just age-related stuff you tell yourself. But what if they're not? What if they are the first alarm signals that your brain is asking for help? If you keep believing that memory loss is an inevitable consequence of aging, let me tell you that cutting-edge science is screaming that you are wrong. The truth is that the way we sleep today is sculpting the lucidity we will have tomorrow. If this topic resonates with you, if you feel a pang of concern, stay with me. Because in the next section, we are going to travel inside your brain to understand exactly what happens when you close your eyes. Let's demystify sleep. It's not a simple on-off switch. When you immerse yourself in sleep, your brain becomes a high-tech biochemical laboratory, a crucial operations center for your cognitive survival. The protagonist of this nocturnal process is a relatively recently discovered system, whose name you should engrave in your mind: the glymphatic system. Think of it as the most sophisticated and exclusive sewage system in the universe, designed specifically for your brain. A network of microscopic channels that expand during deep sleep and use cerebrospinal fluid to flush out and eliminate toxins accumulated during the day. The main of these toxins, as I already mentioned, is the beta-amyloid protein, the villain in the story of Alzheimer's. Imagine your brain as a sponge. During the day, as you think, feel, and act, this sponge absorbs all kinds of metabolic waste. At night, during slow-wave sleep, the deepest and most restorative, the glymphatic system squeezes that sponge, flooding it with clean cerebrospinal fluid that carries all the waste to the circulatory system for subsequent elimination. But here comes the crux of the problem. The reason we are having this conversation: this high-precision cleaning system is extremely sensitive. It doesn't work correctly if certain conditions are not met. If your sleep is fragmented, if you don't reach deep phases consistently, or, and here's the key, if you sleep in a posture that compresses or hinders the flow of that cleansing fluid, the glymphatic system becomes inefficient. It's like trying to clean the streets of a city during rush hour with the main pipes clogged. What happens then? The waste accumulates, day after day, night after night. Those toxic proteins, instead of being evacuated, get trapped between your neurons, creating an inflammatory and hostile environment. They begin to form those amyloid plaques that interfere with neuronal communication, the synapses. It's as if your brain's wiring started to fill with rust and grime. At first, the effects are subtle. A bit of mental fatigue, difficulty concentrating, small memory lapses. You wake up feeling like you haven't rested despite having been in bed for 8 hours. It's not your imagination. It's your brain telling you, last night I couldn't do my job. The waste is still here. Over time, this toxic accumulation begins to cause irreversible structural damage, Neurons die. Memory networks disintegrate. The most terrifying thing is that this destructive process can begin decades, yes. You heard that right, decades before the first clinical symptoms of dementia that a doctor can diagnose appear. Have you ever had a bad night and the next day felt clumsy, irritable, unable to think clearly? Now you know why. It's not just tiredness. It's a temporary brain intoxication. Imagine feeling that, to a lesser extent, but chronically for years. Understanding what prevents this natural cleaning process is therefore the smartest prevention strategy. And one of the most common and most ignored saboteurs is right there in the posture you adopt on your mattress. The time has come to reveal which position could be silently sabotaging your cognitive future. Most of us have a preferred sleeping position, a habit forged over decades. On your side, on your back, on your stomach. That seems like a trivial choice, a matter of simple comfort. But science is showing that this choice has profound consequences for our brain health. And one of these positions in particular is being singled out by studies from prestigious universities like Stony Brook University in the United States as a silent but significant risk factor. Studies using advanced neuroimaging techniques such as dynamic contrast-enhanced MRI have allowed scientists to observe in real time how cerebrospinal fluid flows through the brain in different postures. And the results are conclusive. Sleeping on your back in a supine position or on your stomach in a prone position significantly hinders the drainage of brain toxins through the glymphatic system. Let's analyze why. Let's start with the most common position after side sleeping. On your back. When you lie on your back, gravity works against you. Your tongue and the soft tissues of your throat tend to relax and fall backward, partially obstructing your airways. This can cause micro-awakenings and snoring, and even lead to a much more serious condition called obstructive sleep apnea. Every time your breathing stops or is reduced, the oxygen level in your blood drops, and your brain suffers a small shock. To compensate, the body releases stress hormones and increases blood pressure. In this state of alert, the brain cannot enter the deep relaxation mode necessary to activate glymphatic cleaning. It's too busy fighting to breathe. But even if you don't have apnea, sleeping on your back increases intracranial pressure and can alter the dynamics of cerebrospinal fluid flow. The drainage system simply doesn't work as effectively. It's a matter of pure physics and brain plumbing. The pipe doesn't have the right inclination for waste to flow freely. Now, let's talk about the worst position of all, on your stomach. Sleeping on your stomach not only forces you to turn your neck at an unnatural 90-degree angle for hours, which can compress the carotid arteries that carry blood to the brain, but it also exerts direct pressure on your face and skull. This posture is a recipe for disaster in terms of spinal alignment and, more importantly for our conversation, for the circulation of brain fluids. It's the position that most hinders the work of the glymphatic system. For those over 60, this problem is exponentially magnified. With age, the glymphatic system, like almost all body systems, tends to become naturally less efficient. If you add the sabotage of an incorrect posture night after night to this natural decrease in efficiency, you are creating the perfect storm. You are inviting toxic proteins to stay, accumulate, and begin their slow, destructive work. On the other hand, and here comes the light at the end of the tunnel, sleeping on your side in a lateral position has been shown to have the completely opposite effect. This position seems to be the one nature designed to optimize nocturnal brain cleansing. It facilitates circulation, aligns the spine, and allows the glymphatic system to work at full capacity. But, and this is a very important but, it's not enough to just lie on your side and think the problem is solved. Many people turn over in the middle of the night, use the wrong pillow, or adopt harmful side postures. Later I will give you a practical and detailed guide to master the technique of sleeping on your side correctly and consistently. For now, I want you to ask yourself a fundamental question. How do I sleep most of the night? Is my posture helping my brain, or is it slowly poisoning it? The answer to that question could be the key to those memory lapses you've started to normalize. If back and stomach sleeping positions are the villains of this story, which one is the hero? Scientific evidence overwhelmingly points in one direction, the lateral position. Sleeping on your side is not just a recommendation based on intuition. It is a conclusion supported by rigorous research. Researchers at the University of Rochester, the same ones who helped discover the glymphatic system, used MRI scans to observe the brains of rodents while they slept in different positions. They discovered that the glymphatic cleaning process was significantly more efficient when the animals slept on their side compared to the supine or prone positions. Why? This posture aligns the body in a way that uses gravity to facilitate the flow of cerebrospinal fluid and the elimination of waste. It's like setting up a pipe with just the right slope for water to flow effortlessly. But science goes further. Is there any difference between sleeping on your left or right side? Yes, though subtle, there is. Evidence suggests that sleeping on the left side offers additional advantages. Our body is not symmetrical. The heart, stomach, and pancreas are located more to the left. Lying on this side can improve blood circulation, as the aorta, the body's largest artery, arches to the left. It makes the heart's work of pumping blood easier. In addition, it can improve digestion by allowing gastric waste to move more easily from the small to the large intestine. For brain health, better overall circulation means a better nourished and oxygenated brain, which perfectly complements the nocturnal cleaning process. For older adults, these benefits are even more crucial. As we age, circulation tends to slow down, and the digestive system can become more sluggish. Adopting the left lateral position can be a small change with a big impact on overall well-being. I want to tell you the story of Carmen, a 72-year-old patient of mine from Zaragoza, a vibrant, retired woman, a pillar of her family. She had always had the habit since childhood of sleeping on her stomach, hugging a pillow. It seemed to her the only way to fall asleep. But in recent years, she began to notice her mind playing tricks on her. She forgot medical appointments, confused her grandchildren's names, and one day, the last straw, she got lost. Returning home from her neighborhood supermarket, she was terrified. Her first consultation, she confessed to me in tears, "Doctor, I feel like I'm fading away." Analyzing her habits, we saw that although she slept her 7 or 8 hours, her sleep was not restorative. Her posture strained her neck, and as we later discovered with a sleep study, caused episodes of hypopnea, shallow breathing. Her brain was not being properly oxygenated or cleaned. The change was a challenge for her. Getting used to sleeping on her side at 72 seemed impossible. We started a nocturnal postural re-education program. I taught her to use pillows strategically, a firm one behind her back to prevent turning over, and another between her knees to align her hip and spine. The first few weeks were difficult. She would wake up in her old position, but she persevered. At 2 months, something began to change. She told me, "Doctor, I wake up and I know what day it is." I remember the conversation I had yesterday with my daughter. The fog is dissipating. Carmen's case illustrates a vital point. Sleeping position is not a miracle cure, but it is a fundamental piece of the brain health puzzle. It's a daily habit, or rather a nocturnal one, that can tip the scales in your favor. A small practical tip I gave Carmen and that I give to you now. If you find it hard to stay on your side, don't fight your body. Help it. Place a long body pillow behind your back or hug one in front. This gives your body points of support and security, making the side posture feel more natural and comfortable. Your bed can be an instrument of healing or a silent weapon. The choice, believe me, begins. Now let's contrast Carmen's story with that of Manuel, 68-year-old former bus driver from Valencia. A robust man, always proud of his iron health. Manuel came to my clinic at his wife's insistence, who noticed mood changes, increasing irritability, and forgetfulness that were uncharacteristic of him. The curious thing is that Manuel, having read something about the subject, was already trying to sleep on his side. "Doctor, I do what they say, I sleep on my side, but I still feel awful," he told me, frustrated. As we delved deeper, we discovered the problem. Manuel had a habit of falling asleep on an old reclining sofa watching television. Although he was technically on his side, his body was in a terrible position. His head slumped forward, his spine curved into a C shape, without any proper support. His side position was a caricature of what it should be. The quality of his sleep was terrible, full of micro-awakenings, every time his body tried to find a less painful posture. His brain, once again, didn't have the opportunity to enter the regeneration phase. The change from Manuel was not so much about position, but about environment and support. We invested in a good medium firmness mattress and a cervical pillow designed for side sleepers. We established a strict rule: the bed is for sleeping, the sofa is for sitting. We created a disconnection routine an hour before bed, no screens. Within a month, his wife called me excited. "Doctor, I have my husband back. He's calmer, he jokes again." And the other day, he remembered the anniversary of our first dating, something I myself had forgotten. These two stories, Carmen's and Manuel's, teach us a crucial lesson. It's not just about the position, but about the quality within that position. You must do it consciously, ergonomically, and consistently. Do you identify more with Carmen, trapped in a bad postural habit, or with Manuel, who tries to do the right thing but in an inadequate environment? Reflect on this, because the detail you're missing to regain your mental clarity could be in the way your head rests on the pillow, in the firmness of your mattress, or in the simple act of choosing the bed instead of the sofa. It's fundamental that you learn to listen to the signals your brain sends you. They are whispers at first, but if you ignore them, they turn into screams. Do you wake up tired as if you've run a marathon, even after sleeping your supposed 8 hours? Do you find yourself in the middle of a sentence and suddenly a blank, you forget what you were going to say? Do you find it hard to follow the thread of a movie or a long conversation? These are not things of age. They are distress signals. They are the symptoms of a brain that is neither resting nor cleaning itself properly. There is a dangerous normalization of memory loss in aging. Society has sold us the idea that getting older is synonymous with becoming forgetful. And this belief disarms us. makes us accept as normal what is actually a warning sign of cognitive deficit caused by poor sleep quality. Other alarm signals you cannot ignore include a feeling of confusion or disorientation upon waking that lasts more than a few minutes, morning irritability that has no apparent cause, frequently mixing up names of close people, forgetting commitments or simple tasks you once handled effortlessly. These symptoms often begin so subtly that neither you nor your family give them importance, but they intensify. And one day you realize something isn't right, but you can't identify what it is. The culprit very often hides in plain sight. In your bedroom, identifying these signs early is your best weapon. If you recognize yourself in one or more of them, don't panic, but do take action. It's time to become a detective of your own sleep. Sleeping position is the pillar, but there are other silent factors that, combined, create a destructive synergy. Let's talk about the pillow. The wrong pillow can negate all the benefits of side sleeping. If it's too high, it will force your neck upwards. If it's too low, it will let it drop. In both cases, a misalignment is created that compresses the airways and blood vessels in the neck. This not only affects brain oxygenation, but also creates a bottleneck that prevents proper glymphatic drainage. The ideal pillow for a side sleeper should have the exact height to fill the space between the ear and the shoulder, keeping the head and neck in a perfect straight line with the rest of the spine. Another aggravating factor, an old or inadequate mattress. A mattress that has lost its firmness, that sags in the middle, causes your spine to curve unnaturally. Your body will spend the night fighting against that poor posture, contracting muscles and moving constantly, which prevents you from reaching and maintaining deep sleep stages. But perhaps the most dangerous accomplice of poor posture is sleep apnea, a condition in which, as we have already seen, breathing repeatedly stops and restarts. Most people with apnea don't know it. They think their snoring is normal or that their daytime tiredness is due to stress. But each apnea episode is a direct assault on your brain, depriving it of oxygen. Untreated apnea is strongly associated with accelerated cognitive decline and a much higher risk of dementia. If you snore loudly, if your partner tells you that you stop breathing, if you wake up with a dry mouth or headache, consult a specialist. It is non-negotiable. Finally, the environment. Sleeping with the television on, with the cell phone light on the nightstand, in an environment with intermittent noises. All of this fragments your sleep. The blue light from screens suppresses melatonin production, the hormone that tells your body it's time to sleep. Noise keeps your brain in a state of semi-alertness. Under these conditions, deep cleaning cannot occur. Your bedroom should be a cave, dark, silent, and cool, a sanctuary dedicated exclusively to recovery, not an entertainment center or an office. Evaluate your sleep environment comprehensively. Posture, pillow, mattress, breathing, light, and silence. Every element counts. I don't want you to think this is just my opinion or just another theory. Science supports each of these statements with increasing force. A key study published in the prestigious Journal of Neuroscience revealed that the glymphatic system works up to 60% more efficiently in the lateral position compared to the supine position. 60%. It's not a minor difference. It's an overwhelming advantage. Another research, this time from Stony Brook University, used MRI to directly visualize cerebrospinal fluid flow. Scientists observed that the elimination of beta-amyloid protein was notably slower and less complete in subjects who slept on their backs. It's visual evidence of how posture can facilitate or hinder the cleaning of brain waste. And the connection with sleep apnea is even more alarming. Studies from Harvard Medical School have shown that older adults with untreated sleep apnea have up to a 3 times higher risk of developing dementia compared to those who breathe normally during the night. 3 times. It's a risk factor of a magnitude similar to some genetic factors. Perhaps the most revealing and hopeful data at the same time comes from a massive review of studies published in 2022 in The Lancet. This expert commission concluded that around 40% of dementia cases worldwide could be prevented or delayed by acting on 12 modifiable risk factors. But among the most impactful are the management of hypertension, hearing, and of course sleep quality. The message from the global scientific community is unequivocal. Prevention begins in your bed, changing your sleeping position, ensuring you breathe well, creating a conducive environment. These are not simple wellness tips. They are first-order health interventions. a way to actively protect your brain in the long term. I perfectly understand that changing a lifelong habit, like how you sleep, can seem like a titanic task, but it's not if you approach it with strategy and patience. Here's a practical plan. The simplest and most effective advice is the pillow fort technique. Place a firm, dense pillow, or a couple of them, along your back when you unconsciously try to roll onto your back during the night. This physical barrier will gently prevent you and remind you to stay on your side. At the same time, place a thinner pillow between your knees. This is crucial. It aligns your hips, prevents lower back twisting, and reduces pressure on your joints, making the side posture much more comfortable and sustainable. The head pillow, as we already mentioned, is your other great ally. Don't use the same pillow if you used to sleep on your back. You need one specific for side sleepers, one that is firmer and at the right height to keep your head as a natural extension of your spine. If you've always slept on your back, start the transition gradually. Dedicate the first 20 to 30 minutes in bed to reading or simply relaxing already in the side position using pillow support. Help your body register this new posture as a position of rest and security. Over time, it will become automatic. And most importantly, every night you succeed, you will be giving your brain the best opportunity to repair and protect itself. But the protection of your memory doesn't start when you turn off the light. It starts 1 or 2 hours before. The nocturnal routine, a ritual of preparation for sleep, is as powerful as any medication and without side effects. Here's a step-by-step guide you can implement starting today. The digital blackout. At least 1 hour before bed, turn off all screens, televisions, tablets, and especially your mobile phone. The blue light they emit is poison for melatonin. The cave. Transform your room into a dark, silent sanctuary. Use blackout curtains. Cover any small lights from electronic devices. If outside noise is a problem, consider using earplugs or a white noise machine. Light dinner. Avoid heavy, fatty, or very spicy dinners at least 3 hours before sleeping. A heavy digestion forces your body to work when it should be preparing to rest, which alters deep sleep cycles. The biological clock. Set a fixed time to go to bed and to wake up, even on weekends. Regularity is the language your brain understands best to synchronize its internal rhythms. Prepare the ground. Before getting into bed, prepare your pillow fort. Have your knee pillow and back support ready. Don't let momentary laziness prevent you from doing it. The breath anchor. Once in bed, in your side position, dedicate 3 to 5 minutes to deep, conscious breathing. Inhale slowly through your nose, counting to 4. Hold your breath, counting to 4. And exhale slowly through your mouth, counting to 6. This simple exercise calms the nervous system and tells your mind that it is safe to disconnect. If you follow this simple routine, you will not only dramatically improve the quality of your sleep, but you will also be creating the optimal conditions for your brain to perform its vital task of cleaning and protection. Remember, every night is a golden opportunity to invest in your mental future. We have reached the end of this journey, and now you hold knowledge that can radically change the course of your aging. You already know, there is no doubt, your sleeping position can be night after night, silently affecting your brain health. Sleeping on your back, and especially on your stomach, can compromise the brain's cleaning system, promoting the accumulation of those toxins which, with the passage of years, become a risk factor for dementia. But today's conclusion is not about fear, but about empowerment. With simple changes you can start implementing tonight, such as learning to sleep on your side, adjusting your pillows, and adopting a healthy nocturnal routine. You can take control, you can protect your memory, your lucidity, and ultimately, your independence. Dementia is not an inevitable sentence. It is built in large part through small bad habits that are repeated night after night. The good news is that brain health is also built in the same way, with small good habits repeated consistently. I am Dr. Cezar Villarreal, and my commitment is not just to give you information, it is to give you practical tools so you can live a long, full, and above all, lucid. Because aging with quality of life is not a lottery, it is the result of the decisions you make every day and every night. The decision of how you lie in your bed is one of the most important ones. If this video has opened your eyes, if you found it useful, I ask you to do 3 very simple but very powerful things. First, hit the like button so this message reaches more people. Second, share it. Think of a friend, your partner, your siblings, your parents, someone you love, and whose brain health matters to you. This video could be the most valuable gift you give them. And third, if you haven't already, go back to the comments and tell me from which city or country you are watching us. Your responses fill me with energy to continue creating content that can truly change lives. See you in the next video. Until then, take care of your sleep. Because by taking care of your sleep, you are protecting your brain. And by protecting your brain, you are protecting your entire life.